Hi ladies, it's Kristen here. As women, most of us have had the embarrassing or really uncomfortable, inconvenient moment where our period started and we didn't expect it. If this is a rare event, then that's acceptable. But if this is your new pattern to have irregular, unpredictable bleeding, this is something that should be talked about with your healthcare provider. I want to talk about a specific condition today that often has irregular periods associated with it. What I'm talking about is PCOS, or Polycystic Ovarian Syndrome. In order to understand what PCOS is, you have to know what happens to a woman on a regular basis when she's having regular periods. So normally what happens is once a month, the brain tells the ovaries that you need an egg. So the ovaries respond by creating all these little follicles, which are sometimes loosely referred to as cysts. And what should happen is one of those eggs should become dominant and break through while all these other follicles recede. Then the egg will travel down to the uterus. During the entire month, what's happening is that the ovaries create estrogen, and estrogen talks to the uterus. It basically thickens this lining in preparation for an egg to come down and implant. A woman has almost no progesterone until the egg pops out of the ovary. So progesterone levels are very minimal, and when the egg pops out at ovulation, there's this big rise of progesterone. And progesterone also talks to the uterus. It basically is like a timer. It basically says, okay, egg's on its way, and so it matures and it stabilizes that lining. And then after 7 to 10 days, if there's no implantation, then the body recognizes that a woman's not pregnant, and so those hormones drop abruptly, and that withdrawal of hormones is what causes a woman to have a cycle. So in women that have PCOS, they basically have lots of stimulation of the ovaries, but an egg doesn't break through, at least not on a regular basis. So the uterus never gets that hormonal message of progesterone rising, telling the uterine lining what to do. So basically, PCOS is just a miscommunication or a hormone imbalance between the brain, the uterus, and the ovaries, where those hormones aren't in sync with each other. It also can have other healthcare conditions associated with it. So if you have irregular periods, or if you question what's normal and what's not normal, this is something that you should talk about with your healthcare provider so you can start taking care of your own health today.